Thank you so much, Amisha, for inviting me to be part of this extraordinary event. When Amisha asked me to be part, specifically in this panel, I was very touched. Before I became a medical doctor, I was a promotora de la salud in Dominican Republic. So it's something that is very close to my heart. And having this opportunity to set the stage, because I really want to lead this panel by having the panelists in here share their best practice and this great success that they have implementing community health worker in the asthma care. I want before even I go in details over the panelists, all of you that have worked with me knows that everything that I said, I always pointed the EPR3 National Asthma Guidelines. I always cover my back saying that it's not what I said, is what the guidelines said. So today, even though I've been a promotora de la salud, a community health worker since I can remember, I don't want to give my definition, but instead I want to give a definition that is national recognized, and maybe we'll create a statement for those health insurance or those payers that can look at this information and said, it's been validated by this high-level organization. So I want to share with you the definition of a community health worker from the American Public Health Association. A community health worker is a frontline public health worker who is a trusted member of and or has an unusually close understanding of the community served. This trusting relationship enables the community health worker to serve as a liaison, link, intermediary between health, social services, and the community to facilitate access to services and improve the quality and cultural competency of service delivery. The second one is that I love the most because that's the one that I work in a daily basis. In my institution, I oversee the district, the asthma project under the district implementation for One City Health Services, which is the New York City Health and Hospital, PPS. And the National Heart, Lung, and Blood Institute of the National Institute of Health recognize the work of the community health worker in asthma care because in their publication in 2014, they stated that community health worker and community health leaders who are trusted members of the community they serve and who serve as members of the healthcare team can make unique contribution to help control asthma. And that's great words that we can all use when we advocating for our community health worker because that's how the people that are being advocated for our patients. The National Institute of Health in their publication highlight what is the main component that a community health worker in terms of credentialing and education they should have. I'm not going to go over this in details. Again, I'm going to let the panelists to share their experience here. But I just want to highlight that the National Institute of Health have identified that information. Also, something that it was part of this publication, within the asthma care, they recognize the role and responsibility of the community health worker. And the first one that that is in here, and that's the one that I mainly want to highlight, is that one of their responsibility is recognize that they can do home visits to provide asthma education. Yes, I say asthma education because that's something that they keep saying that that's not their role, is mainly a reinforcement of their education, but someone who is properly trained and have the knowledge, a community health worker can be responsible to provide asthma education and to help reduce or remove the patient asthma trigger. Something that they are not responsible or is not questioned about is that they cannot prescribe, they cannot make any changes in the patient's medications, neither give them medical advice, and we are all clear about that.